Hello there, my name's Hama Doulay. I'm one of the senior health supporters, and my job within Health Exchange is the making sure that we have our sites are up and running, the day-to-day running and managing of our supporters, and also to liaise with management with what we're doing on the shop floor and what management's expectations are. And another one of my roles is to obviously meet the public and give them information and support concerning our services. And some of the services we offer, I'll refer people to, is the long-term medical conditions. A lot of the people we come across, they actually got long-term medical conditions such as diabetes or something like that, or blood pressure, and what they don't realise is there's help and support out there, because basically they're so used to going to the doctor, getting the medication, going back home, and they're not realising that there's more to it than that. And a lot of the people that we encourage and tell about, inform about our services, is we actually say to them, and I personally do emphasise to them, that the doctors are there to give you medication and help and support, but they're not always there, or aren't able to always give you the actual detailed information and sit down and speak to you and give you a breakdown and detailed information about what other things you can be doing with your health conditions, and especially around diabetes. Now, a lot of people who actually have gone on to diabetes courses, long-term medical conditions, and got information and a load of sources of different information about how they can live with their medical condition, because people think it's just eating food, and it doesn't matter what food you eat as long as you're not eating sugar. But what they forget about is the fatty foods and the other things that they're not supposed to be eating, and what they actually come away from these courses with is a lot of information, and sometimes too much information, but nevertheless information that they don't always or won't get when they're at the doctor's surgery with the GP. And that is one of the things we like to emphasise on, is that the information you'll get from us is information that you need on a daily basis, and things, small little minor tweaks and changes in your lifestyle, that doctors can't always sit down and have the time to speak to you about, but we can at Health Exchange through our network of support. And obviously the doctors say to them, you need to cut down, but what they don't do is go into detailed information and tell them that these are all the fatty foods and these are the alternatives. And that is one of the areas we find a lot of feedback from people, is about just changing their diet and how it's helped and supporting them. And we always touch on that with clients, around the food, around the diet, around the exercise. But we certainly get the diehards to come back and say, we have made a positive lifestyle change, and the information you've given me is invaluable. And they haven't always had that information because of obviously time constraints and pressures from GPs.